Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I am a neurologist and a headache doctor. And today I'm talking about to me, it's sort of a difficult to educate patients about area or a series of names. And the title of the talk is Sinus, Allergy, or Migraine Headache. I'm going to try to define this for you. So the maxillary sinuses are located behind the cheeks on either side of the face. And they're innervated by the second division of the trigeminal nerve called the maxillary nerve. And the maxillary nerve supplies the nose, cheeks, and upper part of the lips. The maxillary sinuses are often involved with allergic rhinitis and are a frequent site for migraine headache. So what is sinus headache? Well, there is no legitimate sinus headache, and the name was created by the Sudafed industry in the 50s to sell pseudoephedrine, known as a mild nasal vasoconstrictor and a decongestant. Currently, there are about 200 different Sudafed drugs in the United States, and the name sinus headache is not found in any other country in the world except the United States, and is an inaccurate medical term which usually denotes migraine headache. Also, the word allergy and the word sinus headache are not found in the International Classification of Headache 3, which is like the Bible for headache for the world. So they're not true factors relating to migraine. Allergic rhinitis doesn't usually cause migraine headache unless the patient is stressed or ill from it, from the allergic symptoms. And allergic rhinitis is an aggravating factor relating to migraine, but a separate medical issue, really. Patients with allergic rhinitis may not sleep well, and not sleeping well is a migraine trigger. And there's no allergy headache either. The word allergy is not listed in the index of the International Classification of Headache. So allergic symptoms can aggravate migraine indirectly, but there's no direct allergic pathophysiologic mechanism causing headache. An example of allergic reaction would be cedar, when someone's allergic to cedar, and that's a foreign protein, and that antibody, when it comes in the body, then your body produces an antibody, which is a complex protein made by mast cells in the immune system to combat the invasion. And in the process of all that allergic thing, gamma E is released. Now, many different chemicals cause vasodilatation and therefore aggravate migraine headache. This is the source of a lot of misunderstanding. That's why monosodium glutamate, chocolate, tyramine in aged cheese, and nitrates in hot dogs may aggravate migraine. Yeah, there's a relationship between the ingestion of such a chemical and headache, but the headache comes because of vasodilatation caused by the offending chemical, like chocolate, but not from an allergic reaction. Allergic rhinitis is the lay term for the phrase sinus, headache, allergies, or hay fever. The diagnosis of allergic rhinitis is based on a history of seasonal or continuous symptoms of nasal and eye-located itching, sneezing, nasal stuffiness, clear nasal drainage, and cough. It's usually in families. The diagnosis can be confirmed by demonstration of Ig antibodies, by skin testing, or doing a thing called the radioallergosorbent testing. That's the RAS test. It's a mnemonic. It's RAST. Skin testing is preferred because of the greater sensitivity and the decreased cost. All right, related questions. How is sinus headache related to migraine? Well, Katie, who's a famous headache neurologist, published an article called Sinus Headache, which was a neurology, otolaryngology, allergy, and primary care consensus on diagnosis and treatment in the Mayo Clinic Proceedings in 2005. And this paper was regarding headache in the sinus area and migraine, and the discussion centered around how could sinus headache usually be migraine. Dr. David Dodek, head of the section of headache at the Mayo Clinic, published the Sinus, Allergy, and Migraine Study in the Headache Journal in 2007. And this was an article regarding 100 patients with a self-diagnosis of sinus headache. And Dr. Dodek found 97 of the 100 patients had a diagnosis of migraine alone or migraine with medication overuse headache, which is like overtreating headache. I'll quote the conclusion of Dr. Dodek's report. The majority of those with self-diagnosed sinus headache have migraine or probable migraine. In those patients with migraine, the most common reasons for misdiagnosis include headache triggers, pain location, and associated features. So there's guilt by provocation, location, and association, which is commonly attributed to sinus headache. The clinician must be aware of the unique presentations of migraine so that a correct diagnosis can be made and effective treatment instituted. A portion of patients with self-diagnosed sinus headache suffer from a headache type which is unclassifiable by the current International Headache Society criteria. These headaches are characterized by bilateral maxillary pressure, mild to moderate pain intensity, cranial autonomic symptoms, and the complete absence of migraine features. End of quote. So migraine itself causes vasodilatation of the cerebral and nasal arteries, and this is part of the migraine process. Dilatation of nasal arteries causes congestion or a stopped-up feeling in the nose. There may be headache with nasal congestion, and TV ads teach treatment of the symptoms with something like Cyanide or Advil Sinus. And these drugs have Sudafed in them, which is a mild vasoconstrictor, and also with it there's also a mild over-the-counter analgesic, so the patient's sinus headache gets a little better. How is acute rhinosinusitis diagnosis? Well, the diagnostic criteria for acute rhinosinusitis, which is an infection of the sinus, are clinical, nasal, endoscopic, and are imaging evidence of acute rhinosinusitis. Evidence of causation demonstrated by at least two of the following. The headaches developed in temporal relations, the onset of the symptoms of rhinosinusitis. Either or both of the following symptoms, headache has significantly worsened in parallel with the worsening of rhinosinusitis, and the headache has significantly improved or resolved in parallel with improvement or in resolution of the rhinosinusitis. The headache is made worse by pressure applied over the perineals of sinuses. In the case of unilateral rhinosinusitis, headache is localized on the same side. There's not a better reason for this. So how is sinus headache treated? First, one must understand the phrase sinus headache is an inaccurate term, since it usually relates to migraine. The better question would be the following, which is, how is frontal maxillary sinus located migraine treated? Without proper education, here's how sinus headache treatment plays out. The patient thinks, I have sinus headache. I took sinus medicine, and the headache got a little better. No, really. The patient had a migraine, and they treated with a vasoconstrictor like Sudafed, and usually has a mild painkiller with it, like Tylenol or Advil. The headache got a little better. This headache would have been better treated at onset with one of the 7 triptans, since 80% of persons who treat with a triptan at the onset of a headache are headache-free in 2 hours. And really, triptan is the best acute therapy drugs for migraine now. So, triptan is the best drug here, and if treated onset, this type gives a rapid, effective migraine treatment that pseudoephedrine-using patients only dream about. To have a diagnosis of acute rhinosinusitis, patients should have frontal headache, nasal congestion, and a discharge of pus of a green or dark yellow color. So if it's allergy, it's clean. If it's infection, rhinosinusitis, it should be yellow or green. And to cleanse the diagnosis, the doctor should order a sinus CAT scan to confirm pus in the maxillary sinus, or an ear, nose, throat physician can look inside the nose instrument and make a diagnosis. And Dr. Dodek's study mentioned above, sinus headache, there were 3 scans showing maxillary pus and 97 normal scans of the sinuses for the migraine patients. Well, how do you treat allergic rhinitis? Well, allergic rhinitis is stepwise treatment with antihistamines first step, like Zyrtec or Claritin, stuff like that, followed by nasal steroids, decongestants, and immunotherapy or allergy shots if the patient fails to respond or cannot tolerate the medications. The older antihistamines like Benadryl, which is diphenylhydramamine, are available over the counter but really very sedating and poorly tolerated. And Benadryl is appended to other over-the-counter drugs like Tylenol or Advil and shown under names as Tylenol PM and Advil PM, which is just Tylenol with Benadryl. And it's given at night because it's very sedating. I have a list of different new antihistamines on my blog article on this, which is at drmigraine.com. You might want to look at that. Pseudoephedrine is a decongestant, really, and not an antihistamine. It may be added orally when nasal steroids and antihistamines are inadequate. But the other thing is that some of the antihistamines will have decongestant attached with it. So it's like Claritin may have a Claritin D, which is Claritin, and the D part is decongestion, which is Sudafed. Many patients are taking this. In my experience, they don't know they're taking Sudafed. They're just taking Claritin D. Topical agents such as Afrin nose spray can be used for several days because overuse can lead to rebound congestion and rhinitis medicamentosa, another problem. Patients with severe symptoms should consider an allergy referral for immunotherapy, which is like allergy shots. The International Classification of Headache again states, quote, the term sinus headache is outmoded because it's been applied both to primary headaches and headache supposedly attributed to various conditions involving nasal or sinus structures. So I think that primary headaches such as migraine tension type headache and frontal migraine, rhinosinusitis, the whole literature of that is difficult to understand and clinically sort out. So I'm going to include official statement again from the International Classification of Headache. What do they say about sinus headache? They say, clinical evidence of acute rhinosinusitis may include purulence, pus in the nasal cavity, nasal obstruction, hyposmia, which means trouble smelling, or anosmia, which means no smelling, and or fever. Chronic sinusitis is generally not validated as a cause of headache or facial pain unless relapsing into an acute stage. Migraine and tension type headache are often confused with headache committed to rhinosinusitis because of similarity location of the headache. A group of patients can be identified who have all the features of migraine without aura, and additionally concomitant clinical features such as facial pain, nasal congestion, and headache triggered by weather changes. None of these patients have purulent nasal discharge or other features diagnostic of acute rhinosinusitis. Therefore, it's necessary to differentiate headache attributed to rhinosinusitis from so-called sinus headache, a commonly made but non-specific diagnosis. Most of these cases with sinus headache fulfill the criteria for migraine without aura with headache either accompanied by prominent autonomic symptoms in the nose or triggered by nasal changes. So, if you don't have the above-listed symptoms and clinical findings, you don't have acute rhinosinusitis. So patients with what they call sinus headache usually localize the pain to behind the eyes, the forehead, and the cheeks, which is a migraine area. The American Academy of Neurology has said that most patients who have what they call sinus headache have a diagnosis of migraine made by neurologists, and many of these patients have no purulent nasal discharge, which is a cardinal symptom, and that's really an infection of the sinus area. Well, what does the media, especially TV ads, say about sinus headache? This myth about sinus headache has been taught the American public since the 1950s by erroneous ads such as Tylenol Sinus on TV. And it's a marketing idea made of America to sell Sudafed drugs. And it's common for patients with migraine to have more than one type of migraine, and many patients accurately may name their worst, often one-sided headache as a migraine, but they're not aware that their milder front of the head on both sides of the head sinus headache may be migraine also. Can migraine produce sinus-like symptoms? Well, during the migraine process, the cranial arteries dilate, and that's a process called vasodilatation. With the frontal migraine in the sinus area, the arteries in the nasal turbinates, which are the vascular tissue in the depth of the nose, they dilate, and the patient notices nasal congestion, which is a migraine symptom. So sinus headache TV ads would say nasal congestion is due to a so-called sinus problem. But patients with acute rhinosinusitis should have green or yellow frontal nasal discharge and evidence of infection, not the clear, watery discharge like with allergic rhinitis. I want to talk about pseudoephedrine and methamphetamine. 10 years ago in Dallas, where I worked, there was an article in the Dallas Morning News about a man who went to Eckerd's drugstore, now called CVS, and bought $5,000 worth of Sudafed. The alert pharmacist knew what was going on. He called the cops, and they picked him up in the parking lot and went to his house where they found a quote-unquote meth lab, as he was planning to make from the Sudafed methamphetamine and sell to school children in Garland, Texas, and he ended up in jail. Also, I read that the Wall Street Journal, an article a couple of years ago, was about a man who had a meth lab made in the men's room of the LaGuardia Airport in New York. What was the problem with methamphetamine? Methamphetamine addiction is a big problem in America, and it comes from Sudafed. When I got my medical license to practice medicine in Texas in 1970, pseudoephedrine was a doctor's prescription only, but then it went over the counter. Now in Texas, someone who buys Sudafed at the drugstore has to register their driver's license, while in Oklahoma it is illegal, and Utah has it as prescription only. How about this rough, true statement? The phrase sinus headache is made and marketed by a mafia-driven drug industry in the United States to sell pseudoephedrine. In November 2018, the Wall Street Journal reported that methamphetamine use caused the most drug-related deaths in America just for that 1 month, instead of the usual cause of overdose, which was opiate narcotics, a big problem in America. All right, that's the end of the talk on sinus, allergy, migraine, headache. Please subscribe. Thank you for listening to this. I appreciate talking to you. God bless all you migraine patients.